Ladies and gentlemen, esteemed guests, it is with great honor and great pleasure that we gather here today to discuss the impactful work of Lamsa. We are excited to share insights into our initiatives on addressing mental health and addiction issues. So let us begin. First of all, I will be introducing Lamsa. So Lamsa is the Lebanese Association of Medical Services for Addiction. It is a nonprofit NGO founded by Dr. Zeina Moukarzel. Dr. Zeina, la parole.
Thank you, Muriel. Good morning, good afternoon, everyone, and welcome to Lamsa presentation. First of all, let me thank you all for being here today and thank the organizers for this great opportunity to introduce Lamsa at a global level. My name is Zeina Moukarzel. I am a physician from Beirut, Lebanon, and the founder of Lamsa, an NGO NPO registered in Lebanon since 2013. Lamsa's mission is to advocate, educate, and raise awareness about the harmful effects of the most commonly consumed substance by youth, tobacco, alcohol, and cannabis. Its activities are for the majority delivered by the youth to the youth. Behind every cause and advocacy, there is a story, and Lamsa is not an exception. The story began on the day of my 18th birthday, a day that's supposed to be filled with celebration and joy. However, on that day, I lost my father in front of my eyes to a sudden cardiac arrest. He was a physician himself and also a heavy smoker, his only but major and preventable risk factor. On that day, my life changed suddenly and completely. Then came the time when my children became teenagers. I was very scared when I noticed the banalization and trivialization of tobacco, alcohol, and cannabis use. Additionally, I observed that many teenagers were silently struggling with mental health issues, often going unnoticed and left untreated. Let me now introduce our two ambassadors who worked together on this presentation. Dr. Christos Tsagkaris from Greece. He is now enrolled in an orthopedic residency program in Switzerland. And Dr. Muriel Dib, doctor in dentistry and first-year medical student in Beirut, Lebanon. Please.
Among you and to be working to the prevention and control of substance use among young people and the general population as well. So without further ado, let's go on with the presentation, and to make sure that you stay tuned, we will keep it a bit interactive and divide the presentation into questions. First of all, let's ask ourselves, what is the mission of Lamsa?
So Lamsa's mission is to address addiction and mental health issues among youth by fostering evidence-based education and awareness, and it also aims at empowering Lebanon's youth to prioritize their well-being for a healthier future. Now we're going to ask ourselves, what areas does Lamsa focus on for education, destigmatization?
Well, given the mission, it of course focuses on evidence-based medical education and prioritizes services targeting common substances, especially the ones used by the youth at large, such as tobacco, alcohol, and cannabis. We also, of course, prioritize early screening strategies to identify substance use and risk factors, and of course, promote a healthier community. And these are all important goals. However, we should also keep into our mind and keep questioning ourselves, how are we, and in this case, how is Lamsa aiming to change the conversation around mental health and addiction?
So Lamsa aims to change the conversation around mental health and addiction through empowering the youth to recognize and cope with emotions, screen for psychological issues, and seek help early. It also encourages healthy activities and positive peer support, And also it promotes the change of conversation around mental health and addiction to be positive and non-judgmental. And it also organizes workshops and trains volunteers to deliver talks in schools, universities, and workplaces. So about the implementation strategies of Lamsa, in what ways does Lamsa utilize multimedia strategies?
In many ways, but there are at least 3 ones that we need to highlight here. First of all, by encouraging the youth to engage in healthy activities such as sports, volunteering, art, and music. Secondly, by developing a culture of positive peer-to-peer support and open communication among the youth. And finally, yet importantly, by recruiting ambassadors among Lebanese students and probably students across the globe to spread awareness and support the cause. And of course, speaking of a global cause, we need to connect it with the compass of global action, which in our case is the United Nations Sustainable Development Goals. So is Lamsa really supporting some of the goals of the United Nations? And if yes, which sustainable goals are supported by Lamsa?
We have the goal number 3.5 that discusses strengthening the prevention and treatment of substance abuse or use, including narcotics and harmful use of alcohol. And also the goal number 3.10 that aims at implementing the WHO's Framework Convention on Tobacco Control. And speaking of tobacco control, we're going to discuss how Lamsa manages and implements tobacco awareness initiatives among the youth here in Lebanon. So Lamsa actively engages in tobacco awareness campaigns through a multi-platform approach, including Instagram, Twitter, and our organization's website and others. So I will be asking you, Dr. Christos, what role does Dr. Moukarzel play in educating the community about tobacco addiction?
Well, for a number of years, he has been conducting workshops to educate the community about the risks of tobacco addiction and, of course, offering strategies for prevention and cessation. In this regard, the entire organization under her guidance has workshops for the ambassadors and also broader volunteering groups like Scouts, like the session, for instance, offered to Saint Antoine Scouts in Montreal back in 2019 about vaping and tobacco products, or the so-called new tobacco products. And of course, we need to be always creative and think out of the box. And we have already mentioned that Lamsa uses art in this cause. And now it's the time to ask ourselves, how is really art integrated by Lamsa into health advocacy?
And moving on to the art collaborations, it happens that me and Dr. Christos have collaborated on a project together for the Lamsa Art rubric. And it was a project for the Stem Cells Week prepared by the CBBC in Greece. And it illustrated the stem cells in the treatment of alcoholism aftermath. So Lamsa collaborates with artists to integrate art into health advocacy, and we utilize social media to showcase and promote these artworks, fostering engagement and dialogue around them. But it doesn't just stop here with the artworks. Of course, we have Instagram and educational campaigns. So what are the types of content content that Lamsa delivers through its educational campaigns on Instagram?
Well, Lamsa utilizes all the mobilities, all the modalities of Instagram, like stories and posts, to deliver informative content about mental health and substance use to our followership. And of course, Instagram is a platform, but one can speak a lot probably with an image, but way more with a session, with a webinar. And Lamsa has webinars, and we also need to ask ourselves what topics are covered in this Lamsa webinar series.
Okay, so we hosted a lot of webinars, especially throughout the COVID quarantining, and they were led by medical students And they covered diverse topics that are pertinent to mental health and substance use. They were based on evidence-based information and aimed at fostering community engagement. For example, the topics were around drug use and suicide, psychedelics, gambling addiction, stress management, inhalants, and others. And it didn't stop here at the webinars. Of course, we also had Friday Lives on Instagram, and we called them expert talks because Lamsa serves to advance its mission regarding mental health and addiction by these expert talks, and you will be discussing it further, Dr. Christos.
So we already mentioned content that is related and oriented to the youth, content that is created from the youth and addressed to youth, but of course we always need to keep in mind that the youth needs to be in contact with experts, with senior people, not in age, but in experience, who can share insight and put the things in the right perspective.
Exactly.
And for this reason, Fridays are dedicated to the expert talks that feature expert speakers from different disciplines to discuss pertinent issues related to mental health and addiction and beyond. So there is always a series of very interesting talks with renowned healthcare professionals and experts of the region that are also posted on our social media feeds, are available live, but also all the time to our followership. And of course, apart from all these virtual campaigns and events, Lamsa has also a physical dimension. There are workshops, seminars, and community outreach programs. And now that we hopefully leave the COVID-19 pandemic behind, it's high time to consider and reflect on how such physical events contribute to the impact of Lamsa's initiative.
So Lamsa organizes in-person events, including workshops, seminars, just like you stated. These events contribute and provide opportunities for direct interactions and engagement with the community. For example, we had a meeting with the American University of Beirut Psychology Society representative and one of our ambassadors, and it was about substance use. We also had education and awareness PowerPoints that were presented by our youth ambassadors in many local Lebanese schools. Apart from that, we also had workshops for our ambassadors with national NGOs like Embrace that discusses psychological matters and suicide awareness. We also have the participation of medical students in many congresses, among them the University of Balaman's Medical Student Congress last year, where we had an interactive anti-tobacco stand. And we even had workshops, for example, with 180 DC AUB, where they taught us how to collect data and assess public interactions. So we learn more about the strategies that may increase our social media reach and engagement.
So, of course, Lamsa, as the name states, has been quite active in Lebanon, has been doing a great work there, but the goal is to increase this impact and extend it across the Middle East among Lebanese diaspora, young people worldwide, and given in a multinational team that presents in an international forum, I would say globally. In this regard, Dr. Moukarzel in the past has also participated in the first and second African Health Harm Reduction conferences that are organized by the African Global Health Association by giving a presentation on burnout in medicine. And this is an opportunity to meet other people, other practices, other ideas, and even better understand the language of tobacco cessation and control, ranging from harm reduction to cessation and prevention. But of course, we also need to keep the initial focus of mental health into this perspective. So how will Lamsa address emerging challenges in addiction and mental health?
So Lamsa aims at doing that by continually innovating and adapting its strategies and also establishing partnerships with other organizations and institutions to create a lasting impact on public health. We always participate, for example, in the Lebanese Psychiatry Society Congress here nationally, to invite health professionals so they can come and conduct sessions and expert talks and give us more insight to our followers and the people that are interested in Lamsa's mission. And we will be now concluding.
Of course, so overall, Lamsa has been and is dedicated to promoting mental health and well-being, combating addiction, and destigmatizing these issues within our communities. How do we envision to create a healthier environment for everyone? In general, as mentioned, through educational campaigns, workshops, art collaborations, webinars, physical and virtual events and gatherings. And of course, by working together and creating and extending an extended and supportive environment for everyone. But we should also keep ourselves to the ground and remember that to act globally, we need to start locally. And for this, the next initiatives that you will have the chance to see from our side in the next months include No Tobacco Day, unfolded in Lebanese schools in May 2024. You will also see articles about tobacco and vape published on our website, in the local French-speaking newspapers in Lebanon, and hopefully also in international and especially peer-reviewed outlets. You will also see graphic and narrative medicines as tools to highlight the harms associated with tobacco, cannabis, alcohol, and dependence on substances in general. And you will also see a new leap, which is rebranding Lamsa's Montreal branch by reviving it with a new cohort of ambassadors for the year 2024 to 2025. So thank you very much for your attention. Stay tuned. And for a couple of goodbye, thank you words, I'm passing again the floor to Dr. Muriel.
Thank you so much, Dr. Christos. I would like to extend our gratitude to the BSI committee for the opportunity to present this document during their esteemed online conference. And your support and collaboration have been invaluable, and we are truly grateful for your attendance and attention. Thank you so much.